Andrew LA 200, Andrew CYP 100, Andrew CYP 200, Andrew Derm, Avid, Axeron, Testosterone, Depandro 100, Depotestosterone, Depotest, Duratest.
First, testosterone, for Testa, Zutanzo, Natest, Strained, Testamon 100, Testoderm, Testolin, Testopil Pellets, Testro AQ, Verilon IM, Vugelzo, and Zostan.
And my chemical name is
Androst 4N17B 031.
drug classification. In therapeutic, I am a hormone, and in pharmacologic, I am an androgen.
Now to the pregnancy category, Category X. Studies in animals and humans have demonstrated fetal abnormalities, and or there is positive evidence of human fetal risk based on adverse reaction from investigational or marketing experience, and the risk involved in the use of drug in pregnant women clearly outweigh potential benefits.
Our effects occur by two main mechanisms: by activation of androgen receptor AR and by conversion of estradiol and activation of certain estrogen receptor. The free testosterone is transported into the cytoplasm of the target cells, where it can bind the androgen receptor, or it can be reduced 5-alpha dehydrotestosterone, or the DHT, by the cytoplasmic enzyme 5-alpha reductase. The receptor and DHT receptor complex undergoes a structural change that allows it to move into the cell nucleus and bind to specific nucleotide sequence to the chromosome DNA. The areas of binding are called hormone response elements. That within 30 minutes, the RNA has become activated and the concentration of RNA begins to increase in the
Recruits
prostatic.
other transcriptional regulators to form a pre-ionization complex and eventually induce expression of specific genes. The bones and the brain are two important tissues where the primary effect of me is by way of aromatization to estradiol. In the bones, estradiol accelerates ossification of cartilage into bone, leading to closure of the epiphysis. Me and my active metabolites, DHT or dihydrotestosterone, antagonize the androgen receptor to develop masculine sex organs, including the prostate, seminal vesicles, penis, and scrotum. Antagonism of the androgen receptor is also responsible for the development of secondary sexual characteristics, including facial and body hair, enlargement of the pharynx, thickening of the vocal cords, and changes in muscle and fat distribution.
Hypogonadism in men with low testosterone serum concentration, delayed puberty in male, inoperable breast cancer in women who are 1 to 5 years postmenopausal, androgen deficiency in men with age wasting, women with premature ovarian failure, HIV infection, and chronic corticosteroids.
We come now to the contraindications. I am contraindicated to those hypersensitive in me, to those who have liver and renal dysfunction and cardiovascular disease, men with prostate or breast cancer, pregnancy, lactation, and reproduction because I am teratogenic and may cause fetal harm. I have also a black box warning regarding the risk of venous thromboembolic events or VTEs, including deep vein thrombosis or DVT and pulmonary embolism or PE. Serious pulmonary oil microembolism reactions, including urge to cough, dyspnea, throat tightening, chest pain, dizziness, and syncope, and episodes of anaphylaxis. Use cautiously in elderly patients, in women of childbearing age, and in patients with sleep apnea.
Dizziness, headache, fatigue, tremor, insomnia, paresthesias, flushing, anxiety, carpal tunnel syndrome, depression, vertigo, increased BP, myocardial infarction, stroke, venous thromboembolism, edema, conjunctival edema, nasal congestion, deepening of voice, epistaxis, nasal scabbing, nasopharyngitis, rhinorrhea, nausea, vomiting, constipation, cholestatic jaundice, abdominal cramps, changes in appetite, increased liver
or genitourinary includes hematuria, amenorrhea, vaginitis, decreased libido, decreased breast size, clitoral hypertrophy, testicular atrophy, gynecomastia, enlarged prostate, decreased fertility, nocturia, priapism, urinary hesitancy, and urinary incontinence. In the endo or endocrine includes abnormal GTT or glucose tolerance test, in women change in libido, clitoral enlargement, decreased breast size, in women includes acne, facial hair, gynecomastia, erectile dysfunction, oligospermia, and priapism. In hema or hematologic includes polycythemia, and integumentary or intig includes rash, acneiform lesions, oily hair and skin, flushing, sweating, acne vulgaris, alopecia, and hirsutism. And F&E includes hypercalcemia, hyperkalemia, and hyperphosphatemia.
Establish baseline, the weight, the BP, the hematocrit, the hemoglobin, the input and output ratio, check the serum hepatic function, the electrolytes, cholesterol. Wrist X-ray may be ordered to determine the bone maturation or bone growth in children. Assess edema, cardio symptoms, jaundice, assess mental status, assess signs of masculinization in women, in increased libido, deepening of voice, decreased breast tissue, enlarged clitoris, menstrual irregularities, and in male, gynecomastia, impotence, and testicular atrophy. Assess hypercalcemia and hypoglycemia.
During implementation. For transdermal, apply patch to clean, dry, hairless skin on the back, abdomen, upper arms, or thighs. Do not apply to the scrotum. Avoid application over bony prominences or a part of the body that may be subject to prolonged pressure during sleep or sitting. The patch does not need to be removed while swimming or taking a shower or bath. The size of the application should be rotated. Once a patch is removed, the same site should not be used again for at least 1 week. If irritation occurs, apply a small amount of OTC topical hydrocortisone cream after system removal, or a small amount of 0.1% triamcinolone cream may be applied to the skin under the central drug reservoir of the endoderm system without affecting the absorption. Ointment formulations should not be used for pre-treatment because they may significantly reduce absorption. Patch should be removed if undergoing a magnetic resonance imaging or MRI scan. The system contains aluminum and may predispose the patient to skin burns during
apply to gum region twice daily, about 12 hours apart. Rotate rotating side.
Intranasal, prime pump by inverting, depressing pump 10 times, and discarding any amount dispensed directly into sink and washing gel away thoroughly with warm water. Wipe tip with a clean dry tissue. If gel gets on hands, wash hands with warm water and soap. Priming should be done only prior to first use of each dispenser. Blow nose. Place right index finger on pump of actuator and while in front of a mirror, slowly advance tip of actuator into left nostril upwards until finger on the pump reaches the base of the nose. Tilt the actuator so that the opening on the tip of the actuator is in contact with the lateral wall of the nostril to ensure that the gel is applied to the nasal wall. Slowly depress the pump until it stops. Remove the actuator from the nose while wiping the tip along the inside of the lateral nostril wall to fully transfer the gel. Repeat with the right nostril. Press on the nostrils at a point just below bridge of the nose and lightly massage. Refrain from blowing nose or sniffing for 1 hour after administration.
Deficiency without side effects. Decrease in the size and spread of breast malignancy in postmenopausal women.